in men who have biochemical recurrence of prostate cancer, there are a large number who really don't need hormone therapy, and yet they're very nervous about just continued observation. They'd like to be doing something. So we were looking for a non-toxic, non-hormonal alternative that might modulate PSA in men with biochemical recurrence. And we used Prostate Health Cocktail, which contains lycopene, supplemento, vitamin E, vitamin D, green tea extract, and soy extract. And the poster presents the first 28 patients, although we are continuing to accrue. And we are finding that there are some PSA declines, about 30% of patients. And not represented here is a gentleman who's had a 50% decline who was in the later part of the study. But these men may be delaying or avoiding androgen deprivation. We have very few side effects. There's really primarily just a few patients with some dyspepsia or bloating. There was one elevated transaminases, but this was a gentleman who had consumed a fair amount of alcohol the night before, and it was very reversible. We are measuring testosterone and DHT levels. They're not changing over time, so this is totally non-hormonal, and we're not seeing any hormone-type symptoms like hot flashes. If anything, people feel quite good. And most exciting, we're studying circulating tumor cells with a novel technology developed by USC and Caltech with a Parylene membrane filter, and we are finding circulating tumor cells in some of these patients. So we're going to do some more exploration of what that means. But one of the gentlemen who started out with 2 circulating tumor cells and went to 23 on study actually did end up with radiographic progression. So this might be a way to detect early on patients who really do need to go on to androgen deprivation earlier rather than later.
The answer is
Perfect. Is that enough?